Hi, good morning, everyone. Thank you for joining us. My name is Ana Ibarra. I am a health reporter with CalMatters, a nonprofit news organization that covers California policy and politics. Before we get started, we do want to let everyone know that this panel is being recorded. All participant lines will remain muted, but if you have any questions, please submit them through the Q&A or chat feature, and we'll do our best to group similar questions together and ask our panelists at the end of our conversation. Now I'm going to turn it over to today's host, Ms. Abby Totten, Molina Healthcare of California's new plan president, who will introduce our keynote speaker.
Thank you, Ana. I want to welcome everyone today on behalf of the MolinaCares Accord and Molina Healthcare of California for an incredibly important discussion on helping children thrive post-COVID-19. We are blessed this morning to have State Superintendent of Public Instruction, Tony Thurmond, to offer opening remarks about his work supporting children over the past year and as they transition back to in-person learning. Superintendent Thurmond was sworn in as the 28th California State Superintendent of Public Instruction on January 7th, 2019. He is responsible for the largest public school system in the nation, with more than 6.3 million students in over 10,000 schools. Since taking office, he has worked to improve equity, access, and opportunity for all of California's public school students. He's created initiatives that are focused on closing the achievement gaps for our state's most vulnerable kids and is dedicated to supporting educators in delivering an equitable education to all of our students. During his 4-year tenure in the Assembly, Superintendent Thurmond authored legislation that successfully expanded the free school lunch program, bilingual education, and the Chaffee Grant College Scholarship Program for foster youth, as well as legislation that guaranteed preferential voting rights for student school board members, improving access to families for early education and childcare, and shifting millions of dollars directly from prisons to schools. State Superintendent Thurmond is a social worker, educator, advocate, and public school parent who continues to work tirelessly on behalf of all students to reach their full academic potential. Thank you, Superintendent. I'll turn it over to you.
Abby, thank you. And thank you to Molina Healthcare for convening this important conversation and with the framing of, how do we help our students, as they move out of the pandemic. It's sometimes difficult for me to even get my mind around that concept when you think about what this year, these 14 months have been like. 60,000 Californians who've lost their lives, nearly 600,000 Americans, and many of our students who have had direct experiences in different parts of the state. We know that many of our students, in particular our students of color, have had direct experiences. I can tell you firsthand, we're hearing from many parents that they're not sure yet if they want their kids to come back. They've got questions about safety. Schools have had to really rethink many things. How do we support educational needs of our students? And schools have also had to get involved in health conversations, and sometimes to do so without health staff and resources. So it's important for us to be able to partner with Molina Healthcare and others who can help us to have access to the information, the knowledge that we need. I don't have a health background, nor do I have any health staff that directly at the California Department of Education. But yet I found myself convening meetings with each of the 58 county health officers to think through what advice might we give schools when they thought about reopening, our close work with the California Department of Public Health, and of course our work with behavioral health organizations, because we know that now more than ever we need to be thinking about the well-being and the social emotional well-being of our students. I look forward to what the panelists have to share. I hope that as you talk today and share your thoughts, you'll think about students who are returning to campus in ways that probably are unusual to them. Everyone's wearing a face mask, at least for now, still social distancing. I know that there are different rules coming out of the CDC, but we expect that for now, our students are returning to campus and they're wearing a face mask. Of course, we're asking students to do something they've not done directly, and that is to have COVID tests and vaccines. And so, there's so many things, and we've worked to put on webinars on the importance of vaccines, in the Latinx community, in the African American community, because it's not lost on us that the communities that have experienced the highest rate of risk and exposure to the pandemic and the highest rate of infection have had the most barriers and the least access to getting access to these important health resources. We ask you to think about the whole child needs. As Abby talked about, we care deeply about physical well-being of our students. You know, during the pandemic, our schools have provided more than 500 million meals to our students and families. We've seen hunger spike up. There are a number of bills in the legislature, and I'm happy to be supporting one that will make it easier for our families to get access to free meals and to resources that they need. We've been working for the last year or two to provide more resources for community schools, which can provide health and mental health resources. And the governor has proposed billions more in his most recent budget proposal, billions for community schools and for behavioral health services. I myself have created a mental health coalition to help us engage school psychologists and social workers and MFTs and school counselors to work together to figure out how we expand the social safety network as it relates to offering supports. We've done webinars on social emotional learning and training for educators and students. And of course, I'd be remiss in talking about the impacts of the pandemic if I did not talk about the impacts of what I call the pandemic of racism, that our students have literally witnessed, the killing of George Floyd on their television screens, the kind of trauma that comes with that, a spike in hate crimes against the Asian American Pacific Islander community. We've created an initiative that we call Education to End Hate, because we wanted to provide resources to schools to do professional development that focuses on anti-racism training and training to counter implicit bias. I would just ask you all to be thinking about all the needs of our students. And as I've asked you to think about students who come back in ways that might feel strange, I'd ask you to think about our youngest learners, kindergarten students who returned to class this month and last month, many of them stepping foot on a campus for the very first time. And so there's a lot that we can do to help them through literacy programs and tutoring programs and mentoring programs and professional development for their teachers and classified staff. But just to set the stage, I hope that you'll give thought to these things, not to mention that we still have 1 million students without access to high-speed internet. And some of you might say, well, why would Tony Thurmond bring that up? One, because that's an important tool to connect our students for learning and preparing for the future. But for many of our students, we saw in the pandemic that the lack of a computing device and the lack of high-speed internet meant that they weren't able to get access to telehealth, including mental health. And so we see all these things interlinked, the learning needs of our students, the health needs of our students and families. And of course, we have a significant challenge of how we're going to help students who are age 12 and older to avail themselves to a vaccine, because we know that can be a game changer for keeping everyone healthy and safe. We've been very busy, and for those who are interested, we've worked with a number of providers to make 5 million rapid COVID tests available to our schools for free. We just think that provides the kind of awareness when you can get results in 15 minutes. So you know who may need to quarantine safely while you keep the rest of the school community safe. We are available to continue working with Molina Healthcare and all of our healthcare providers and our schools, of course, on how we braid these concepts of health, mental health. We're sponsoring a number of bills to expand Medi-Cal, because that's an untapped resource in California, and we are not maximizing that. And I'm making the gamble that if we do more around Medi-Cal, we can provide more mental health resources to our students and families. So thank you for your care for our 6 million students. Continue to be safe and well. We look forward to the benefit of your wisdom from today's panel. And of course, we are always available to work closely with you. So I'll turn it back to you, to our hosts, Ms. Ibarra, thank you, and to others. And we look forward to the conversation.
Thanks so much, Superintendent Thurmond, for setting the stage really to our discussion today. And now Abby will talk a bit about what Molina Healthcare has been doing in the community this past year.
Thank you. And thank you, Superintendent. It's amazing to hear all of the great work that you already have underway, not only as it relates to COVID, but really addressing the fundamental underlyings of equity in our community. For Molina Healthcare of California, our fundamental mission is to serve the underserved, and that means in particular our children. Right now is a time of crisis. For many families, they cannot meet their basic needs of their children. It is our responsibility as members of our community to do everything we can to make our children successful. Molina Healthcare is dedicated to addressing the full spectrum of children's healthcare needs, including everything from primary care provider access, well-child visits, immunizations. We had the opportunity to pivot our own teams to move from in-person to home, which included our nurse practitioner program to make sure our kids could get in-home nurse practitioner visits and meet their wellness needs. We also take a very integrated approach to care coordination for children's physical and behavioral health needs, making sure that our most complex kids have a coordinated and comprehensive approach to their needs, including support for their families. As we move into the future, we're focused on how do we create new partnerships that drive innovation across the spectrum of care in our local communities to make sure that no child falls through the cracks and that we're able to effectively address their needs when they need that particular service or support. Now, as we're looking at the panel before us today, I have to say, as a mother, this is a particularly near and dear to my heart panel. We all know that COVID-19 has had an incredible impact, not only on our day-to-day lives, but the lives of our children and the trajectory of their future. COVID-19's impact on children's mental health, their learning, their social supports. I know for my own kids, they missed out on those basic milestones that kids have in their lives. Little things like birthday parties, hugging their grandparents, and having the opportunity to play in their community. But there has been so much great work that has gone on over the last year, and our panelists are here to talk about the great work that we've done across LA and across the state to meet our children's needs. This panel is going to lay out a little bit of what's been going on and, more importantly, where we're moving into the future to make sure that across all of the sectors, not just healthcare, but healthcare, government, and community organizations, to work together to support our children and make sure that they flourish. Ana, I'm going to turn it over to you to introduce our incredible panel today. Thank you.
Great, thanks Abby and your team at Molina Healthcare and the MolinaCares Accord for putting together today's event. So let's jump in now by introducing today's panelists. First, we have Stacy Scarborough. She oversees human resources at Venice Family Clinic and directs its Children First Early Head Start program. She has extensive experience developing programs that serve children and families. Ms. Scarborough oversaw the expansion of the clinic's Early Head Start program into Inglewood in 2010 and led the clinic in securing a grant that doubled the size of the program and added services in Inglewood and Hawthorne. She also serves as the president of the Head Start California Association. Next, Yolanda Vera oversees healthcare, public health, and mental health issues for Los Angeles County Supervisor Mitchell. She previously served as chief counsel and senior policy advisor to former LA County Supervisor Mark Lee Ritt Thomas for 9 years. Ms. Vera was the chief executive officer of the Martin Luther King Jr. Outpatient Center, and she serves on the board of the MLK Health and Wellness Community Development Corporation in South Los Angeles. Catherine Flores Martin is the executive director for the California Immunization Coalition based in Sacramento and works in partnership with coalitions and organizations that support the mission of ensuring that everyone has access to vaccines. She has over 25 years of healthcare experience involving healthcare systems, private medical practices, public health departments, nonprofit organizations, and numerous volunteer activities. She has worked in the immunization arena for 20 years in health promotion, coalition development, registry recruitment, and program management. So welcome everyone, and thank you for being here. Let's begin with an overview of how kids fared during the pandemic. We know that we're not totally in the clear yet, but the focus and conversation is shifting to how we can respond and make up for what children lost this past year. So Yolanda, let's start with you. Maybe you can share a bit about what children in Los Angeles County experience, both in terms of the number of infections, but also when it comes to school enrollment and participation. And because LA is a large populated county, how did these experiences differ by community?
Well, thank you, and it's a pleasure to be here. And I appreciate the invitation and to be talking with so many other esteemed colleagues. Um, so I represent and work on the health-related mental health, public health for Supervisor Mitchell. In LA County, we have 5 districts, and LA County's over 10 million people. Our district goes as far north, I'd say, as Koreatown, goes out west towards Culver City, extends all the way south towards Compton. And it includes an area in South Los Angeles, which was, by all the data, probably one of the hardest hit areas with the COVID crisis. Overall, in the county, I'd say we had about 1.2 million positive cases of COVID, and sadly, about over 24,000 deaths. And so we saw an immediate impact of this at the time that the pandemic was the worst. I was still over at the MLK Outpatient Center and could see a line of about 1,000 people a day queuing up to be tested. And it was a very terrifying time, and you'd see families with small kids standing in line, just like 1,000 a day. And at its worst, we were about a 25% positive rate. The good news is that we're now down to about a 0.6% infection rate in LA County. And as the dust settles, we're starting to roll out the vaccines much more aggressively. We've made some good progress overall. About 60% of our residents age 16 and older have at least 1 dose, and about almost 50%, maybe a little less, have been fully vaccinated, and higher rates of vaccine if you're older, 65 and older. Our kids, we're just starting to roll out the vaccines to our kids. And as of last Friday, I checked with our department, and we've had about almost 16,000 teens ages 12 to 15 have been vaccinated, but that's only like 3% of our target. We've got a huge number of kids that we've got to target. There's a higher number of kids, 16 to 17, that we really need to target. As to what the overall effect is and the hit has been, my boss is really big into equity and really making sure that whatever resources we have get really targeted to the communities hit the hardest. I can say, as well as a mom, I have a 20-year-old whose college experience has been completely blown out of the water from what many of us, when we went to college, it was living in the dorm and just completely growing emotionally and socially through independence. And that's completely been turned upside down, as well as it has been for my nieces and nephews and my grandchild. So I can see the effects, the anxiety, and just different little social markers along the way that they haven't experienced. You multiply that times 10 in areas like South LA, where they don't have the same benefit of a strong internet system, where many of them have lost family members, where many of their parents have lost jobs. I think we're going to see probably an increase in the number of reported domestic violence situations, but many families felt vulnerable, that if they reported, somehow their only income support would be lost. Huge numbers of hunger. So that's why we're rolling up our sleeves and eager to talk to you to figure out what we can do about it and how to respond. So I hope that helps.
Yeah. And Stacy, what trends did you see in terms of COVID effects on kids from a clinical standpoint?
So thank you, Anna, and it's nice to be here with all of you. What trends did we see from Venice Family Clinic being in the Los Angeles area? We did see that, children and families were not coming into the physician's office. We definitely did see that. And that took a little bit of extra effort from staff to really be calling and talking to families, talking about the one-on-one scenarios, explaining the safety measures that are put into place so that it is a safe place and it is safe to have immunizations, and it is safe to have your doctor visits. Also, a lot of lab visits did not happen because if there's an extra step, families weren't, willing to take that extra step to get the labs to complete those physical exams. For dental, there was a lot around dental because dental was, would open and close depending on where the surge was at. And that became very confusing for families. And so dental exams have really dropped. We've noticed that they are now coming back up, but that was a service that was confusing in the message to families. I can tell you from nutrition, as kind of Tony was saying, Ibarra was saying, is that, that was a very big need. That was a huge need. And we started to do additional meal services and then also vegetables and fruit bags to families that we actually delivered. When we opened the center, we noticed that the kids were eating thirds. Usually kids that would eat one time and be okay, they needed 3 helpings. And so there was just a lot of hunger around that. And of course, the social emotional piece. We did notice that our children's scores in social emotional went down. And one of the things that we did was we started parent support groups for moms and dads, separate for different needs, so that we could see if there was stability in the home with the parents, that the children's scores for social emotional could come up. So I think in terms of health, if you look at health in a comprehensive way, from physical to safety to dental, nutrition, you can see that it impacted the children in all ways from their environments. The first thing that happened in the week when the pandemic kind of hit is that we went out and delivered to the young families diapers and wipes. We knew that was an immediate need. And it was Friday at 5 o'clock, I'll never forget it. And a staff member called and the mom came to the door in which she was completely beat up. And at that point, we made a decision that we will deliver services each week and use it as our wellness visit. To have families just be completely out there just wasn't going to be meeting the health needs that we saw of our community. So when you look at the comprehensive part, I think it touched every part. And then how did we work around to make it successful for the families? Thank you.
These past 14, 15 months have been, challenging for us all, but we know children really absorb everything going on around them. They've seen family members get sick or lose jobs. They're not going to school. They're seeing scary, news reports. In 2020, last year, the CDC reported a national uptick in children's mental health related emergency room visits compared to 2019. So let's talk about how kids are digesting what has happened and what can be done to support them. Yolanda, what is government or LA County doing to address some of the loss of services due to school closures?
Well, we're doing a heavy look at this, and there's a number of things that we're contemplating. I'll talk about one, making sure that people know the services that we currently have in place right now. The Department of Mental Health has had a number of programs that they've used pre-pandemic. Everything from a partnership with UCLA, which does a lot of training and virtual trainings that support teachers and counselors on how to identify trauma, suicidal ideation, other things like that, and how to also deal with, now that we're post-pandemic, how to deal with your own trauma, because many of our teachers are also anxious about returning to the classroom, and many of them also experience personal loss. So one of the things that we're doing, and just a board discussion about that, is making sure that our schools in particular are aware of the resources that are out there. Everything from a chat line to trainings. They're going to create this virtual, this tool book, which will have, hey, these are all the resources for your parents in your community if you have crises. And then training on how you identify someone who needs help. So the hope is that we can then identify funds once we're certain that people know the resources that are there, of expanding those resources. As we think about getting our eyes and ears out to understand challenges, one of the key partners is our school-based health centers and wellness centers. We have a number of them throughout the county, and we're fortunate to have a number of them. And these are our schools that provide full wraparound services to students. And they have performance benchmarks that they try to meet. Pre-pandemic, they were things like, annual well-child visits, annual risk assessments, BMI, nutrition, depression screening, chlamydia. And this was lost during the pandemic because it was a chance for someone who was trained to touch a student and see whether there might be some need to do some further intervention. So I think those school-based health centers, as the students are returning, are going to be hugely critical in terms of how do we get our eyes and ears out to try to support the students to do what they need. And then I think finally, there's no finally. There's a number of other things that we're also doing around violence prevention. We've noticed with the pandemic an increase in violence, and particularly concerned for many of the reasons that were mentioned by our first speaker about the impact of all these violent images, whether they're about racist incidents or other incidents that they're having on our youth, and noticing an increase and trying to figure out how we can intervene into the schools and elsewhere with diverse programs. But what I always wanted to say last is that our county is getting $1.9 billion in one-time American Rescue Act funds. We're also looking at how we can use these funds. They're one time, but how can we use these funds to bolster some of our efforts to foster wellness among our youth, so that they're not the lost COVID generation.
Stacy, given the stressors and social and academic losses, how does that translate to what you're seeing in your clinics?
So some of the things I can kind of share, and I kind of like to give life stories, is that, for example, when you come to the center, you are screened, or to a clinic, you are screened, your temperature's taken and all of that. So children are used to having their parents asked many questions about COVID related. Did anyone have a cold? Just, sneeze, all that. And it's interesting to me because this young child was in a classroom. We're talking like 2 years old. And usually pre-pandemic, children would tell their teachers everything. It's very interesting that when the COVID screener came to the classroom, the child went up to the COVID screener and said, "My dad hit my mom." And this generation is now learning, this is the person you tell things to. And so it was a very interesting dynamic. They are learning different things at this age. Also, when we've talked with our childcare providers, the hyperness of a child in this age of 0 to 3, this person touched this thing, this person didn't wash their hands. She said there's this whole new generation of kind of telling on each other, because it's so ingrained in them. You can't touch, you can't play, you can't get, you can't do some sensory. So I think there's definitely been that. I also think for children with disabilities, when there's been like remote evaluations or remote services, it's extremely difficult to do the evaluation. We've had to follow children around with iPads to give that evaluation. That is very difficult for children with disabilities. We had a play group when we had just opened them up, and of course they have all the safety guidelines. When it was time to go, we had a child at the top of the playground apparatus crying and screaming. She was not going to go, and she knew her mother could not get her. So she gave the phone to the father, to the toddler at the top. There's just so much social emotional around the changes. And this is the age when you're really learning and practicing social emotional. So to have taken that away we see all different kinds of behaviors that I'm kind of sharing, that when they come back to in person under different guidelines. It's just, it's hard for them. When we started remote, we had a child that was, on screen with her home visitor, and she felt rejected. She could not get on the screen. She was so upset. And we had to bring in a mental health specialist to help that connection through a remote world. It just was, I'm so hurt you're not at my house. And so I just think there's so much social emotional with this piece in the real, in what has happened.
Yeah, that's so interesting. Catherine, let's bring you in. You do a lot of work in the space of preventive care. Given the pandemic and all the issues that we're left with now as a result, what does this mean for the work that you do?
Right. So we have known, I've been working in public health for over 20 years, 25 years, and epidemiologists, public health professionals knew that this was going to happen someday. And a lot of people did not take this seriously, as it does sound, tremendously unlikely. And we also thought it would be a flu virus that had mutated or shifted. And so this happened, and public health, I think, was not surprised, but we were not prepared. One of the things we really need to do is build our infrastructure and regain the respect for public health. I think a lot more people do have that respect and do have that appreciation, a much deeper appreciation of our healthcare providers and our public health infrastructure, but not enough. We need to take it seriously and keep this momentum going, this interest in making sure that we're supporting our school nurses, for example. I know we're going to talk about that a little bit more. The school community is, children, their life, their universe is the school. And so, and when you've got one or two or three in school, that is your family's universe. And so having a strong school network and support through school nurses and school health centers, I think, is really vital. So we are working with providers, especially, that's one of our key roles, working with providers to communicate and effectively with parents, and most importantly, making sure school nurses have adequate support.
Yeah. As a health reporter this past year, I've reported pretty much exclusively on the pandemic, and I think the topic of school closures has probably been the most closely watched. You have input from parents and teacher unions, school districts, and all the while students are sort of caught in the middle doing Zoom school, right? Or at least trying to. At CalMatters, our team has reported about the lack of reliable and affordable broadband for some students that made virtual school pretty much impossible for them, like Superintendent Thurmond mentioned. We reported about the academic and developmental regression at some special needs students. I've written about the shortage of health resources at school, even pre-pandemic, like school nurses, as you mentioned, Catherine. And we've also reported about the inequities, right? The fact that children in private schools or more affluent areas are more likely to have gone back to the classroom sooner than children in public schools and poorer communities. I'd like for us to talk about the challenges of remote learning and what's being done now to support children. So Yolanda, in general, what do schools and children's support services in LA County look like now? And where are they going, especially given, as you mentioned, the federal COVID relief dollars that come into the state and counties? How is LA County and its public health department spending that money?
So just a little bit of background. The LA County is getting this money, it's 1.9 billion. The cities are also getting money. The school districts are getting money. There's some earmarked money for our various county departments like public health for specific purposes. In terms of the money question, the process in LA County is that the various, with like 36 departments, they all came up with their ideas on how we should spend these dollars. I think there's 1.9 billion and over $3 billion in ideas. And then what the CEO did was they asked the supervisors for their priorities and concepts. We shared that with the CEO after having like a community meeting to get some feedback. And now we're in the process where we're just waiting for the CEO to come back to the Board of Supervisors with, okay, I heard you. Here's how I recommend that the county spend the $1.9 billion. Some of it will deal with kids. Some of it will deal with other issues, everything from the digital divide to housing related issues, to food, to income programs, across the whole range of things that it may and hopefully will benefit this targeted population of youth that we're thinking about. The county's role in the school system is really right now, even though our county has like 81 school districts, like $1.3 million kids, many of these school districts are not under the power of the Board of Supervisors. We have our LA County Office of Education, which deals with those school districts that are in unincorporated areas. And so we work with them and have been working with, they're called LACO, in terms of an approach. And so the county has more of an influence on how that rolls out. But I would still say, regardless of what the governance influence is across the school districts, the school population is a priority for our health-related groups, whether that's our mental health, some of those programs I mentioned, public health, also doing a lot of close work. They identified about 60 school districts in the particular higher risk areas, and they're doing more intensive training and outreach and getting vaccines to those schools. And then I think our Department of Health Services has done some backup work. I think we could do more on school-based health centers. Then we have our other programs, which also have a huge impact that I think we could leverage as a county. We have our arts department, because through many of our youth, you don't want to pathologize therapy. And it really works if you do things, whether it's dance therapy, artwork, that helps them express, what they're going through in a non-clinical type setting. So among the things we're doing is investing in things like hip hop dance and other ways just to particularly target at-risk youth. We also have our Parks District, which is really active, and then also our libraries are really active in terms of outreach programs. And then our Department of Children and Family Services, I know they're trying to do a boost up on how they can continue our monthly home visitation, especially for at-risk moms. So the need is great, but we're trying to figure out, because we understand more needs to be done, and there's some fortunate availability of one-time funds, but you need to really spend those thoughtfully, because they're exactly that, they're one-time dollars. And so how can we work with our nonprofits, our private partners, who frankly are more nimble than the county when it comes to implementing some of these programs to really immediately reach the youth and their families in need.
Yeah. Stacy, what about younger children? What was the impact on children and families when it came to remote learning, remote working, and childcare?
Yes, I think for most of the population that we serve, our families were not remote workers. They were in the jobs of essential workers, and they were in the position of being laid off. So there wasn't really that option for the population that we serve. But what that brought was, rental concerns, housing. The homework for siblings was a really difficult thing, whether there wasn't space in the home or technology or just a language barrier in understanding that piece. And so that led to kids just not participating in school, which is a concern, because school is a way out of poverty. And so this kind of put you back that generation back in this situation during this time period. Another challenge, I think, for young children was when the centers were open or childcare was open, the COVID screening is pretty strict. If you have a sniffle, you're not coming in. And so what that meant for families that were working was that they had to take time off. And there were long periods that you were taking time off. I mean, you were out for 10 days. And so that was very impactful I think, on the families. And there was a lot of families really talking about with younger children that they can't focus on the younger child because the other children were at school at home. And so that was also a tough situation at that point.
Yeah. And Catherine, the moving on to vaccines a bit, the Pfizer vaccine recently became available to teens 12 to 15 and is expected to become available for younger children 2 to 11 before the end of the year. Will schools have a role to play in vaccinating children, and how successful do you think efforts to vaccinate children will be? Are we going to see a pushback or more hesitancy from parents, perhaps?
Yes, good questions. So very exciting, number one, that we have a vaccine. It's just amazing from, the vaccine world. The fact that we had a vaccine this quickly is unbelievable, that it is so safe and effective. So effective, and has such broad support throughout the world. So that's number one miracle. I think school nurses are just very key. I've always been a big fan of school nurses forever, obviously. But I think, of course, as I said before, that availability in the schools where it is available, and I know the LA area, it's a little bit better than some parts of California too, but not enough. So I think school nurses, they are well positioned. They're used to doing school clinics. When we've had flu clinics during, I think, starting H1N1 and before. Well, if you go way, way back, they used to do school clinics when I was little. You just lined up and everybody got vaccinated. Things were so different than now. Now it's a lot of consent. It's every consent forms and parents and lots more infrastructure. But that's good. That's good. But we have such a huge opportunity for school nurses to be the leaders on this, and then our healthcare providers. I know the pediatricians and family physicians are going to be much more involved. Mass vax clinics work well for adults, even for teens, but for younger children, it's going to take more care. And when it comes to the hesitancy side and the communication side for parents, we are 100% want parents to get their questions answered. It's completely reasonable to have questions and concerns. And I think in this this environment, we've really learned a lot about the range from, I'll take whatever vaccine you got, I want to prevent disease, to no, nope, never. There's a big middle, but there's a very movable middle that they just want the answers. They may not be the first step. They may not second or third. They may not do it till the end of the year as adults, or for their children, may down the road. But they're not lost to us. We want to make sure they feel that their questions are respected and that they can get those answers. They're not anti-vax. We have that whole network as well. But those concerns are valid, and we want to make sure they have those answers. And sometimes it's going to take time, and that's going to be the challenge, is this middle time where we'll have some children vaccinated. We have some teachers that won't be vaccinated, right? We'll have a lot of people that won't be vaccinated, some children that won't be vaccinated. So how do we manage this mix right now, respectfully?
Yeah. Abby, let's bring you back in now. Perhaps you can talk a bit about, what Molina Healthcare and its Medi-Cal providers are doing to increase vaccination for children, at least for those ages 12 and over who are eligible now. And I know the age expansion is quite recent, but do you have any sense of how that's going so far?
Yeah, as a mom who got my daughter vaccinated this weekend, I'm super excited to have a vaccine for kids. We've taken a lot of time and effort since the beginning of the pandemic and the release of the vaccines to make sure that we're doing very active and engaged outreach to our members to get them in for vaccination. So it's not just incumbent on our healthcare providers, but as insurers, we need to make sure that people know their vaccine clinics. We help them get them connected. And for Medi-Cal, where transportation is free, we set up the transportation to make sure that they can get there and get home. And so we've been really blessed to have a great team who, not only do we have the data analytics to support finding the members, but we have a team who's, good at cajoling folks into, are you sure? This is a great opportunity to actually get them into services. I will say, for adults, we're really seeing the same thing that you're hearing about in the media, which is we've kind of hit those folks who want to get vaccinated, and now it's, there's a pretty decent portion of the population that really says, I don't want to, or they don't trust the vaccines. And so it's really now about educating people about the opportunity and what it really means. And so even with kids and families, we're taking the same approach, which is you got to educate people. They have to feel safe about going in to get their vaccine, and they need to understand that we're there to support them all the way along the way to make sure that they're getting the services they need. So we've really had some good outcomes, but we'll continue to support those efforts and make sure we get people in, whether it's through our own staff supporting pop-up vaccine clinics. We've done vaccine clinics with the county public health departments, with clinic partners, to make sure that they're available in odd hours and in different places than you would normally see vaccines. So we're really excited to keep that going.
So we've talked a bit about, where we've been, where we're going, and COVID is likely to be with us for some time, whether it be because of annual vaccinations or really just working through those repercussions. Before we open it up to questions from the audience, I do want to ask one last one, and I don't know if we have time for everyone to answer, but maybe one or two of you can jump in here. You each represent different sectors in health and the well-being of children and families. As we all rethink the role of public health, what are you doing now to prepare for the next pandemic? And how do you think COVID has changed the way your organization sees its role and future work? Maybe Stacey, we can start with you, and then if someone else wants to add in.
Sure. I think, we've learned a lot through the pandemic, and we've learned some benefits that can happen from remote services. So I would see us continuing, support groups have worked very well in remote services. We've purchased special earbuds for parents so that children wouldn't hear maybe a topic that's not appropriate for them. We've done some exercise classes on remote. We've done a music class, language and literacy on remote. So I think there's a lot of things remote in terms of training and education that we will continue with. We also are big vaccine providers, and we've been providing them not only at the clinics, but we are providing them at the Early Head Start Center. It's a much more comfortable place for children and families to come. And we're doing one this weekend, and we have bubbles and crayons, and, we're making it a little bit, more of a service. And I see vaccines being part of just the normal work that we do moving forward. And so I think, post-pandemic, those are things that we will keep and carry on that we've learned work well for our populations.
I'd like to jump in a little bit as well too. I think we learned a lot, and there was a lot of humility as well too in some of our learning. I think we, among other things, the glaring effects of the disparities came home to us, and it killed people. And so I think really realizing the urgency that we need to address these health disparities, it's become more heightened because we saw what the impact is. I think we learned about the dangers of going fully on an electronically based healthcare system, and nothing replaces that individual touch experience for many of our targeted individuals, especially our seniors who just cannot manage on their own. Many of us have parents, and we know what it's like to try to teach them how to get onto the internet. They can't manage an electronically based healthcare system. And so really rethinking what that means. I think the other thing we learned is the value of CBOs and others that really embrace a more culturally sensitive approach. I think the vaccine hesitancy, I really resonated with what previous speaker Catherine said about hesitancy, and that people just want to be listened to. And that's what we learned in our South LA community, is that, yeah, there was hesitation for a lot of valid reasons, but when we reached out to them, heard them, and listened, many of these individuals came in to get vaccines. We just had an event this last weekend. We had 600 people turn up for vaccines. So I think embracing this kind of culturally appropriate, take people where they are, working with our partners, our FQHC clinics, unbelievable how well they got vaccines into the community, much more effectively than the county could do. And so I think taking these lessons and then really building an infrastructure and investing in these one-time investments to prop up our IT systems to the extent they help those individuals who use IT, and then really embracing flexible, creative approaches to deal with those hard-to-reach populations.
Catherine?
Yeah, as much as we want to put this pandemic behind us, and I know some people already have in some ways, we need to keep up this momentum, as Yolanda was saying. We need to keep up the momentum of partnerships. There's hundreds and hundreds of organizations just in California working on projects around immunization. It's all day long, every day on the news. We want to keep this momentum going and not fall into a historical amnesia where we put it behind us. This is probably not going to be a one and done. We have this vaccine, we have flu vaccine, we have other vaccines to prevent disease. I think people's awareness is much greater now. And for us, we want to keep that momentum going in terms of awareness and prevention, not the trauma.
Abby, do you want to add anything?
No, just, something that struck me about each of the panelists today was that we don't really know what the future holds. And one of the, building the infrastructure on the public health side is the beginning, but there are so many ways where we are going to need to be more creative to meet the needs of our children, because there are long-term ramifications of the last year and a half that we can't predict today. And so we're going to have to work collaboratively to address those issues as they come at us, because, we can't necessarily grow more doctors or more psychiatrists or more, clinic workers on trees. And so we're going to have to take a new approach. And it's only through these types of diverse and collaborative conversations are we going to find those solutions. So I feel like the future really means we all have to look outside of the four walls of our industry to make sure that we're accounting for all of the resources and all of the opportunities that collaboration can provide to make our kids successful.
Yeah. So we do have some audience questions. So I'm going to pull up a few here. And if you have any questions, again, please feel free to add them into the chat feature. So this one I thought was interesting because I hear about this a lot from parents, and it's, until kids are vaccinated, how comfortable should parents feel about bringing them masks to group settings like sports or movies? Does anyone have an answer for that?
I'm not a doctor, but I know many, many doctors, and I think the general advice is that kids are still at risk if they're vaccinated. And so, for my nieces, and they're going along with it. When we're in a tighter group setting around individuals who may not be vaccinated, they're wearing masks, and so, but I'm hoping that there might be somebody with expertise on the phone, but certainly on the website of the Department of Public Health, we have the guidance, and that's essentially what it is.
Yeah, the American Academy of Pediatrics, CDC, have guidance. I'd refer to the health departments but our position is children should be masking up until we can make sure they're more fully protected.
Yeah. This one might be for you, Yolanda. Says, how do folks see Newsom's proposal for childcare preschool playing into a post-COVID world and children's health?
I'm sorry, could you repeat the question again?
Yes, it says, how do folks see Governor Newsom's proposal for childcare preschool playing into a post-COVID world and children's health? So as you know, there was like a large investment in K-12 and childcare.
I know, and I know that is an important priority for my boss, who was the former director of a large child care agency. And I know definitely there were proposals from the board that looked at the importance of childcare, especially since the pandemic really hit a lot of families, but working moms in particular. I think it hasn't, the county officially hasn't taken a position on it yet, but I anticipate in the next few board meetings it likely will, as we learn many of the details. And I know Supervisor Mitchell will be looking at it closely and lending her expertise on it.
Yeah. So maybe we can wrap up with this question. It's just simply, maybe Abby, this is for you. What can families do to find affordable health coverage for both adults and children in California? Oh, Abby, we can't hear you.
Oh, sorry, I double muted myself. I knew it was going to happen at some point. Everybody has to remember that for the uninsured, there is always access to healthcare coverage through either Medi-Cal or Covered California. And really going onto the Covered California website and applying through their online portal gives you the opportunity for both Covered California and for Medi-Cal coverage. And there are also an array of resources out in the community through community-based organizations, federally qualified health centers that can help get families connected to coverage. We should remember this state, more than any place in this country, has made sure that our population has access to affordable health care coverage, and they should absolutely take advantage of that.
Great. Well, I think, that wraps it up. We're just right at almost at 12. So thank you everyone for joining today's conversation. I don't know if anyone has any closing remarks, but I think that is it for us.
Yeah, I want to thank everybody for attending today and Anna for moderating and our incredible panelists. It's great to see such an array of strong leader women from our local communities, and really appreciate the opportunity to be here today. For folks who want to learn a little bit more about Molina and MolinaCares, visit us at molinacares.com, and we hope to see you again soon.
Thank you very much.
Thanks, everyone.